Hello, everyone. Welcome to the Cancer Doctor podcast. I am your host, Robert Carrillo, and today's guest is Dr. Jamie Waselenko, who is an integrative oncologist at the Cincinnati Integrative Oncology and Functional Medicine. You can find her online at ciofm.org. We did a previous podcast with Dr. Jamie that you can look up where we go extensively into her background and how she became an integrative oncologist. So I recommend that everybody tune into that to learn more about Dr. Jamie. We're having her back today to have a part 2 about gut health. This was something that we discussed previously. And so we have more questions, some additional considerations that any patient diagnosed with cancer should take into consideration when it comes to the gut. Dr. Jamie's very unique in that she has over 28 years of medical experience as an oncologist, and many of those, or the majority of those, have been as a conventionally trained oncologist. Fortunately for us, she has expanded her training and she has become an integrative oncologist, incorporated more functional medicine, continues her own personal education, and it makes it really fun to speak with her, and she has a lot to offer the public these days. Dr. Jamie, thanks for being with us today. Really appreciate it. It's always good to have you back.
Thank you, Robert. It's an honor and pleasure to be here. It is always, I think, important for us to be able to shed light on some of these very important topics. And I'm so thankful for the support from Cancer Doctor. So thank you. And again, it's an honor to be here.
Oh, you're welcome. You know, Dr. Jamie, the last podcast that we did together brought up some important questions as it relates to the gut. And you had encouraged patients. I want to start off with this question. You had encouraged patients that it was really important for them to test, assess, and not to guess when it comes to this. Can you color that in a little bit, help us understand why that's so important to do that?
So it's a very thoughtful question. And I think based on our discussion from part 1, it really was important for us to have a part 2. So one of the important items is really getting to the bottom of the gut issues. So for example, some patients may think I can just go on a probiotic and that's going to get my Akkermansia where it needs to be, and I will be able to respond to my immunotherapy. And the reality is you really need to be tested. And so, for example, a lot of people will have chronic GI complaints, and some of those complaints, as we talked in part 1, were related to their stomach acid being actually not low enough. And they end up being on proton pump blockers, which even makes them less acidic. And when that happens, it really affects everything downstream. And many patients end up on those medicines for years and decades, and they don't realize their subsequent health issues, their psoriatic arthritis, their depression and anxiety, their Hashimoto's, their autoimmune diseases are all linked back to a medicine they started a decade ago that they're still continuing. So it's not just in terms of cancer implications, it's in terms of chronic health issues that grow over time and people that stay on these medications chronically. From a cancer standpoint, it's critical to see a physician, a provider that is versed in gut health. And I'm not talking about a conventionally trained gastroenterologist. And so I think that was one of the big items when we left off that I just wanted to reinforce. And I'll go a step further. If your oncologist has you on an immunotherapy like Keytruda, pembrolizumab, Opdivo, Nivolumab, and there's a whole laundry list of them, so I won't go beyond that. But if they have you on those medications and they're not recognizing that you're on a proton pump inhibitor and that you're on chronic Tylenol and your Vicodin or your Percocet, or maybe you're on recurring or chronic antibiotics, then they are not recognizing or not addressing that those medicines lessen your chance of having an anti-tumor response. And so those immunotherapies can be so important in the anti-cancer journey that it's critical that patients be tapered off those medications, right? But it has to be done thoughtfully and with a doctor that knows how to do that. So you cannot abruptly stop your PPI because now you know that it's going to be a problem with your immunotherapy, because people can have rebound effects that are even, their symptoms are even worse. So it has to be thoughtfully tapered, and you need to have a provider that's going to work with you to figure out why you have this reflux issue. Is it really because you actually need more stomach acid so you can get the lower esophageal sphincter to close so things don't go up into the esophagus? So I bring that up because your conventional oncologist should be aware of those medications that negatively impact your immunotherapy, but they may not be, or they're moving so fast they don't recognize it's on your medicine list, sadly.
We want the patient to test their gut, not necessarily with a GI doctor per se, but somebody who's very well versed in gut health, because if the patient is on a proton pump inhibitor, for example, taking God knows which medications, that may very well be undermining the immune therapies that they're receiving for the cancer diagnosis and neutralizing it or doing something worse. Is that correct?
Absolutely.
Whoa, okay.
Absolutely.
That's huge. And then did I hear you correctly? Like a typical GI doctor may not be asking, hey, are you on a proton pump inhibitor? They may not even be asking that question.
The typical GI doctor may be the one that's put them on the chronic proton pump inhibitor.
And so they wouldn't be thinking of taking the patient off of this at all.
Likely not.
Okay. So
this gets to that thinking. We've got to think beyond conventional medicine. And I'm just going to, and I think for those people that know my story, right, I had been indoctrinated in conventional allopathic medicine, which is heavily influenced by the pharmaceutical industry. So my colleagues, as good as they may be, probably don't recognize some of their knowledge deficits, just as I had not 5 years ago, right? And it is critical that we start to recognize that, and also recognize that conventional insurance only really pays for that pharmaceutically enriched environment, right?
Right.
So that's why it's so important that we go to a provider who can think outside the box and can get to root cause illness, root cause issues. Really, nobody in allopathic medicine is trained to get to the root cause of your problem. That's why people end up on a polypharmacy with 30 medicines over the years. And probably 2/3 of those really don't even need to be there if you actually went to somebody who could get to root cause, and maybe a majority, right? And so sadly, conventional medicine has become a pill for your ill mill, right? You've got 10 minutes with your provider. You got acid reflux. Well, we'll just put you on a proton pump inhibitor. That way you will no longer have that complaint, and you think you're actually doing okay, not recognizing how important your stomach acid is, and everything below the stomach will no longer work as it's supposed to, right? So the symptom went away, but nobody ever got to the root cause issue, because in conventional medicine, they are not trained to get to a root cause. They're only trained to really palliate your symptoms. And that doctor, they're doing what they were trained to do. They're meeting the standard of care, and they're probably not recognizing that chronic proton pump inhibitor may cause you a downstream of a host of other health issues, some of which I alluded to, right? Because there is a gut-skin axis and a gut-brain axis and a gut-thyroid axis and a gut-everything axis. So they won't recognize that now that you have psoriatic arthritis, that it was really linked to your proton pump inhibitor, and you really have gut dysbiosis and leaky gut, as an example.
Got it. Yeah, and here at Cancer Doctor, we're always encouraging every patient we meet, whether they're diagnosed with cancer or not, to think differently about how healthcare is paid, their personal healthcare, we recommend they do pay out of pocket or become a member of a health share network so that they can find a real professional that can get to the root cause and not simply throw a medication at their symptoms. So we're all in on that, right? We think that's the best way to approach health. On that note, when it comes to, let's just say paying out of pocket to test your gut to find out what's in there, and let's assume the patient is on a proton pump inhibitor. When we do this gut test, what specifically are you looking to find in that gut or not find in the patient's gut that's been diagnosed with cancer specifically? Just as a starting point, what's the value here, right? At that level of entry.
So excellent question. Some of this we did touch upon in the first podcast, but those types of tests, and I'm not wed to a specific brand of test, right? There are some so there's just a variety of tests, and you want to go to a provider who's comfortable interpreting the test that they use. So I think that's important also. But those tests will really give you really a variety of very important information. Often it will look at, are there any pathogenic organisms right up front that could be causing significant GI illness? There'll be another page that will look at what are my good guys? What are my commensals? Are they in a good number? Do I have good representation? Because when the commensals, the good guys are low, like Akkermansia, for example, is the big one people talk about in having a connection with immunotherapy responsiveness. That's on that page, but there are others that can actually have that influence as well. So that's why it's not just Akkermansia. But you want to make sure you've got good representation of your normal bacteria. And then usually another part of the report will look at, do you have any pathogens that are overgrown, right? Do you have, too much Pseudomonas? Do you have too much Klebsiella? These are just types of bacteria. Do you have Candida? Do you have fungus? A part of the report will actually even look at certain parasites as well as protozoan or worms. So it actually looks at a lot of pathogens, right? So it's a very data-rich report. Then there's a portion of the report that actually looks at kind of digestive function. There will be some clues there, whether or not you need stomach acid, for example, whether or not you need pancreatic enzymes. Some patients will have an immune deficiency in their GI tract, and so there will be times that we'll add some immune support. There's different products that we use temporarily. Building up the commensals will also boost the immune system of the GI tract. There are markers in there that will look really for, is there blood in there? Is there evidence of high inflammation? That's called a calprotectin. And then there will be a marker, usually at zonulin, to look to see if there's evidence of leaky gut syndrome. So it's a really powerful report that you don't get in conventional medicine typically.
So typical GI doctor is not going to be running this test, and I could see the value of it now. That explanation is very helpful, because if the patient's not doing this, a GI test like this, yeah, you truly are. You're playing in the dark, as far as your treatments and how this is interplaying with your gut health, right? Is that correct? Am I on target there?
Absolutely.
Okay.
Absolutely. And let me give you an example. So I have a patient right now who has an ovarian cancer, and she's been having bleeding from her GI tract for almost a year. She's had a couple of scopes by her GI doctor. They did a test early on her to make sure she didn't have C. difficile, but she just continues to bleed from her GI tract. Now she's on a blood thinner because she had a blood clot, so that's kind of accelerating that issue. But we did kind of the GI testing And I won't tell you the brand because it doesn't matter because there are many quality brands out there, right? But we did a good GI test to look at the things that I just mentioned. And so we found that she had overgrowth of a bacteria called Fusobacterium, which can be heavily linked with her type of cancer. We found overgrowth of multiple pathogenic bacteria, which can lead to leaky gut. And this is likely contributing to why she's bleeding so much. We found blood in her stool. We found inflammation because her calprotectin was so high. And we found that her zonulin was very high that also went along with leaky gut. So her gut was a mess, right? And so this is likely why she was continuing to bleed and bleed and bleed, just because the mucosa was so inflamed. But the conventional gastroenterologist didn't pick up on any of this because he wasn't taught to do that kind of testing.
Thank you. That's really, really helpful. And I think at the same time, it's frightening, quite frankly, that you could be in a health crisis. And, when I think about the gut, I know you know this, I mean, the abundance of our immune system is in the gut. It's what we know today. So to neglect it by ignoring all the possibilities that could be taking place in there, well, that's a major contributor to our recovery for any of us, really. If we want to be healthy, we need to take care of our gut. I know we never think about it. We just think, well, we could just throw whatever we want in there and health is going to pop out the other side, but that's not the way the body works. So thank you for explaining that to us. And you mentioned a little while ago that there's a lot of different gut tests that are good tests. And that leads me to the next question. A patient doesn't know about these tests. Are there certain questions that a patient can ask a provider? And I'm not talking about a GI provider now. I'm talking about somebody who specializes in the gut. Is there certain questions that the patient should ask to determine whether or not, well, this one is a quality gut test, that this is worth spending my hard-earned money for, this test in particular? Because someone's going to be thinking that right now. I don't know what test to buy, and how do I know the test that this gut provider is offering to me is high quality? Is there a way for them to verify this?
So it's a very good question. Let me just reinforce just a couple of things you've just mentioned. First of all, patients are going to have to invest in their health. They're going to have to invest because insurance is not going to cover this. If all you're wanting is to use a provider that will take your health insurance, you will likely stay on the pill for your ill mill the rest of your days. That's my first comment. And so it's important to recognize that providers that have been taught to train to think outside the box, to get to root cause issues, are kind of outside the mainstream the insurance paid system. Okay. So I want to reinforce that point. The second point is I don't think some people may want to get into looking at data on which GI tests do I want. You just have to realize, and there's some that may be a little bit more congruent. There are some that I like a little bit better than others. But what you don't want to do is be in the situation where you're telling your naturopathic doctor, your functional medicine doctor, I want this test, and they're really not skilled in interpretation and working with that test, right? So I think part of that has to be looking at the provider that you're wanting to see, right? Do they have a good reputation? Do you know people that have seen them? And you can often do a discovery call with that person to say, hey, do you do GI testing? What tests do you usually do? What is your track record? How much does it typically cost? How many visits before I really start to see improvement in my gut health? And that may span 6 months to a year. So this is very different than the pill for your ill mill, where you get a prescription, you feel better, and you think you're good, right? You may have to work through a time figuring out how much stomach acid you're going to need, what other adjustments need to be made. When your gut is filled with pathogens, you can initially get worse before you get better. Because as those pathogens die off, right, and endotoxins are released, patients may temporarily feel a little bit more bloating, may have some diarrhea. And they are not, it's important to recognize you may have that little bit of phase when things are getting cleaned out before you actually start to improve. So I guess I would focus a little bit more on my provider, see what they recommend and why, and focus more on that, because I want that provider to be comfortable with the tests that they're ordering. Oftentimes, especially if the GI tract is in significant disarray, they may need a repeat test in the future, but you're going to have a relationship with that doctor probably at least over a 6 to 12 month period to be working on getting your gut in order. But I will tell you that it's very likely that if you make that investment, not only are you going to have a higher chance of getting a response to your immunotherapy, you're probably going to start to see less health issues. Gee, my joint pain went away, my psoriasis went into remission, my thyroid's doing better, right? I can get tapered off my antidepressant. So making that investment in your gut health can make you globally more healthy. And so that's why it's so critical, because it has ramifications in all aspects of your health. The other thing, I guess, to reinforce, Robert, is people need to recognize that everything that makes us sick makes our gut microbiome sick. So all those lifestyle things that we've talked about in the past are critical, right? It's not eating garbage. It's eating whole foods. It's staying away from sugar, inflammatory seed oils, trying to stay away from the dairy and the glutens, which we know can be very inflammatory to the gut. It's getting 8 hours of sleep a night. Because if your cortisol's up and you're not sleeping enough, your gut is also going to be affected by that. It's exercising. It's grounding. So all those lifestyle things that sound kind of fluffy and touchy-feely are critically important in our health and in our gut health.
So since it's more important to find a healthcare professional who has a high level of competence with the test itself, the interpretation of the test, that's really what you're looking for. How do we help patients find those providers? Is there a listing out there online? Do you happen to have, a listing that maybe we could post on our podcast? Maybe it's, hey, 2 or 3 providers that they work nationally. I don't know. There's so much that is done now remotely with patients today. But what could we offer to the patients as far as, okay, here's a place where you can find these providers that do this?
So excellent question. I think we can share some links for you that you can post under the podcast where people can get started. Mm-hmm. They still have to ask the right questions, though. And what I mean by that is, for example, I had a family member that went to see a functional medicine doctor close to where she lives, and she has significant autoimmune issues. And I was confident that functional medicine doctor was going to do gut testing on her right up front. And what she got, and this is a certified provider who does functional medicine, but that provider really only focused on neurologic links to illness. She didn't do gut testing at all, right? So that was, I guess it was a little bit of a learning curve for me too, because it's important to recognize just because it says naturopath or just because it says functional medicine or integrative doctor, you want to ask, do they use that as a tool to help you? Because if they don't really do any GI tract testing, that's a quick one to mark off the list. And I wish more people put that on their website, but they don't. So I would start with people in my local area that are naturopath or functional medicine or an integrative doctor. And I would ask if they have experience in helping people to get off proton pump inhibitors. Do they do some form of GI testing? Do they have any experience on getting gut health remediated in patients that have a cancer diagnosis? Because in an active cancering process, I would not recommend that patient go on a glutamine healing strategy which can be done by many providers, because glutamine is great with healing the gut, but because it can actually stimulate cancer, I would want that avoided. So we would want that patient to have other therapies, and there are others, right, to help soothe and heal the GI tract as the other areas of abnormality are addressed. So it's hard for me to give you a name. I think looking in the local area, I think you can actually also look in the area in people within your state. For example, I saw a naturopathic doctor locally who was amazing. I also saw a functional medicine doctor by Zoom who was in Columbus. He did a great job also. So I was very pleased with those interactions. And I work now, I see a provider who's also in a different state because he can see people across the country. So I think some of it is going to be to do a little bit of a local search. And if you're not getting satisfactory results, I think looking at some of the societies that we have listed, I think the key part of this is people are going to have to do a little bit of legwork, and they're going to have to make a few phone calls to make sure those questions are satisfactorily asked. And almost all of these providers do a discovery call, which is for many of them are free.
Let me recap that, because that was really helpful. So first of all, if I'm a patient and I want to get a quality gut test, we want to find the practitioner that has a level of competence interpreting the test itself, but checking in with naturopaths, functional medical doctors, these type of individuals in your local area, but then asking the right questions, starting off with, do they even provide a gut test there? And is it a fundamental tool that they use in order to improve the patient's general health and wellness overall? Because if they don't start there, or they don't even provide the test, then you can cross that one off your list. Also, how do they use this testing in order to help patients maybe gradually get off a proton pump inhibitor, possibly? Do they have experience with that? That's another great question to qualify. Does their practice do that? And do they also do the testing in order to help remediate a patient's gut, a patient specifically who was diagnosed with cancer, to help heal that gut for the overall response of the treatments that they may be receiving for the cancer diagnosis? I got that down. And then also, does that provider utilize glutamine as a healing strategy of the gut, though it may be helpful for the general population? A patient diagnosed with cancer may not be helpful. It may actually proliferate or increase the spread of the disease, of cancer, someone diagnosed with cancer specifically. So did I recap that well? Did I capture it?
No, that was excellent.
Okay,
thank you.
Perfect. Yeah, because that's really helpful. And so often when I'm speaking with a patient diagnosed with cancer, they don't know the questions to ask. And so these kinds of questions really empower them. And we're all about empowering the patient here at Cancer Doctor. We feel once they're empowered, they know what to ask, their confidence rises up, and they feel a level of autonomy again, like they're back in control. Because so often someone diagnosed with a health crisis feels like they just lost control. And at that point, they feel defeated. But coming alongside them, helping them with the questions to ask, provides some level of control again and empowerment so they can continue on in their healthcare journey. Is there anything that we've missed in this part 2 on the gut that we didn't discuss that we should bring up? I know we touched on a number of items here that were important. Is there anything else that the viewer should know?
I think those really illustrate the points that I felt needed to be reinforced after the first podcast. I do want to reiterate, though, for patients getting immunotherapy that actually have an active cancer diagnosis, Tylenol, proton pump inhibitors, and other acid blockers, and those might be things like famotidine or Pepcid, as well as antibiotics, all lessen that responsiveness. The other important point is if low Akkermansia and some other bacteria are lessened in the GI tract for whatever reason, right, that will also lower their ability to respond to that immunotherapy. And so it's just important to do the testing and working with someone to make sure that you're where you need to be. So I don't want people stopping their proton pump inhibitors acutely because they'll likely have rebound phenomenon and feel like they can't ever do that. I don't recommend people just throw themselves on acromancy and think that that's not enough. They really need to get to the bottom of why would their acromancy be low to start with, right? It's getting back to that root cause issue. It's getting tapered off those other medicines that might be having an impact on it. And then it's supporting digestion, supporting commensals, keeping the bad bacteria at bay. It's healing the gut. It's making sure if there's leaky gut present, it has been healed. So I just wanted to reinforce that part of it. And again, the whole reason we're having this conversation is gut health affects every facet of our health, but it has a significant impact on whether or not patients are going to respond to to their anti-cancer immunotherapy in particular, potentially chemotherapy. There's data to suggest that. Potentially their radiation therapy. There's additional data to suggest that. Their CAR T cells, their bone marrow transplant. So it's a significant issue, which is why I want to encourage people to make that investment in working with a good provider, whether it's a naturopath or an MD, matters not, a good provider who's well versed in that and knows how to manage and help heal the gut in a patient with a cancer diagnosis.
Yeah, what you just said is just so mind-boggling to me. Again, I'm not a medical doctor. I'm a layperson at the end of the day. But what you're saying is so very important that everybody needs to take to heart, that you could be receiving a chemotherapy, radiation, some type of immunotherapy for a cancer diagnosis. And if you're on a proton pump inhibitor, there is a minimum, a possibility, maybe a probability, that it is actually undermining those other treatments. You're not going to have a good response. I liken it to the house is on fire. We have the fire department here pouring water on the structure, but there's somebody in the back that continues to throw fresh dry wood into the fire, right? This is what you're explaining to me. It's like, okay, we're treating it with chemo, radiation, immunotherapies for this condition, but the proton pump inhibitor is more dry wood into the fire. Potentially, this is what's happening. And this is terrible. This is absolutely terrible, in my opinion, which is why I would encourage everybody that's viewing this, if this is you, if you're on an immunotherapy for your diagnosis, or even, chemo or radiation, you need to go find someone who specializes in the gut to get to the bottom of what could be happening there so that you're not undermining your core treatment plan so that you recover. I know Dr. Jamie, doctors always have a way of communicating these things in a very professional manner, I'll call it, which is great. We want that. But for myself, on my side of the table here, because I'm not a medical doctor, I feel I can feel very passionate about these things, and I want people to be healthy. And sometimes they hear a doctor, but they're not really hearing what the doctor is saying, that they don't understand the gravity of the situation. And that's where we come in sometimes. Wait a second, you're in a proton pump inhibitor? Have you had your gut tested? You haven't? Do it now. Find that provider today and pay money out of pocket. Do not be thinking your insurance company is going to pay for it. They're not. Go pay the hard-earned money, because this may be the one piece to your puzzle that helps you respond positively to your treatments. Don't take it for granted. So, Dr. Jamie, I just want to thank you again for coming on. It's been great seeing you again. It's always great to talk to you. I look forward to talking with you again. Maybe on this topic, continuing it, or a different topic. I really do appreciate your willingness to come on and speak to our audiences today.
Absolutely. And thank you again for allowing me to be here. the importance of this cannot be overstated. So I just hope this helps whoever needs to hear this. If you're on an immunotherapy, if you're on some of these medicines, you must see a qualified provider now and make that investment, because it may save your life and it may help you just globally in terms of all these other health issues that are coming from a sick gut.
Yeah. All right. Thank you. All right, everyone. If you want to learn more about Dr. Jamie, please see our first podcast that we did with Dr. Jamie Waselenko. You can also find her website at ciofm.org. That's a long one for Cincinnati Integrative Oncology and Functional Medicine. And obviously, we have more information about her as well at cancerdoctor.com. She is a verified provider of ours. All right. Thank you very much, Dr. Jamie. We'll talk soon. God bless.
Blessings.